It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160. I'll tell you what, if you get yourself named after a month, you get to be on twice in one day on the first day of that month.
You'd be surprised a number of people ask me how to spell my last name.
Dr. Ralph May is here on May the 1st, and he's not only here with himself, but he's here with Jonathan Hunte, who is the IRMC Clinical Care Coordinator. This being the month of May, it is Mental Health Awareness Month, and we want to talk about that subject here this morning. In fact, this is the first of a series of conversations we'll be having on that topic through the month of May. And our conversation this morning brought to you by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Gentlemen, good morning.
Morning.
Good morning, sir.
Good to have you both back with us here this morning. Jonathan, IRMC Clinical Care Coordinator at IRMC. How long have you been there?
I've probably been there for only a year and 7 months, maybe around that time.
Yeah. That's probably a job that is a little bit quieter behind the scenes that we don't hear as much about, but it's a very important one, isn't it?
It is, absolutely. We deal with a lot of the outpatient side. We work with the different offices for the Indiana Physician Group in Indiana County.
Yeah. Okay, so this is a subject, and Ralph, we were touching upon it a few moments ago. This is a subject that is, it's become such a part of the conversation about overall health, especially since the pandemic hit, hasn't it?
Right. And we're here on behalf of the Suicide Task Force, and we've been around for 35 years, but men's health issues and the way men are differentially affected by depression and suicide is really something we've noticed, first of all, nationally. 80% of the suicide deaths in the United States are men. Mm-hmm. In Indiana County, it's 90% are men between the ages of 30 and 65, the so-called men in middle years. And one of the things that we've noticed is it's very difficult, and I'm not downplaying the suicide risk to our youth. We have a lot of issues there with young people after the pandemic. We have Safe to Stay and other programs in place. But for men, there aren't specific programs for men who are struggling with depression and suicidal thinking. The only contacts that many men have are with their primary care physician. So Jonathan and his team at the IRMC outpatient practices have been ramping up the screening for depression and the screening for suicide. Indiana County is very classically affected because rural men, have twice the suicide rate of urban men. And then veterans, construction workers have a higher suicide rate, and farm workers and farm owners. In our area, the impact family farms have felt in the economy, the stress on that group has gone up. So we're seeing the suicide rate in that group specifically go up as the stress on that group increases. So here in Indiana County, our concerns are for everyone who's at risk, but we're specifically interested in the group of middle-aged males and later-aged males because there doesn't seem to be a lot of resources. And truth be told, men are, I don't know how you are, Todd, but men are notoriously bad at waiting to the last minute when things are really bad. You wait till the house is on fire before you do something instead of checking your wiring and making sure you got fire extinguishers and don't put the gasoline next to the water heater kind of thing. So men have to be reached to understand that depression and suicide is a health care problem. Mm-hmm. It is not something to be ashamed of or embarrassed about. It's not something to tough out. Toughing things out, the work ethic, that's a great thing. But in this situation, it's a bad plan. Talking is doing. Talking with someone, getting out of your own head and being able to talk to someone who listens and understands is really the critical piece here. And family physicians and primary care practices are a place where at least some men go.
Yeah. Jonathan, let's bring you in on this conversation because the primary care physician becomes one of the very first people on the front line.
Yes, absolutely.
Yeah.
So whenever the doctors do their screenings, they'll ask their questions, and even let's say they ask question if you ever had thoughts that you were better off dead, and they say yes. Patient says yes. Now that raises our attention, raises the doctor's attention, and the doctor might come in and will say, hey, I have this patient. He scored high on a depression screening, and it prompts us to be like, okay, like, does this patient want to talk to us? Are they looking for resources? What do they want? And we might even go in with the Columbia suicide screening, which will ask them a number of questions. There's 6 questions on there, and depending on where their mindset is, maybe they aren't, like, they've been having thoughts, but they don't have a plan. And we can talk about that more. Sometimes it is a little bit more severe where they might have to be sent to the ER to be evaluated. Each situation, it depends, of course, but we navigate the best that we can.
Doctors who aren't classically trained in psychological profiling might find it difficult to embrace this new protocol. Not the case, though, here in Indiana County, from what I understand.
Honestly, no. I would say that the doctors do pretty well in reaching out to us and doing the screenings, and trying to address mental health. I think it is something that is more prominent now and more talked about now, and something that is very important to, as well as their physical health, because your physical health is just as important as your mental health, and they work hand in hand, and your mental health can affect your physical health. I believe that the doctors are doing a good job in doing these screenings, and they're reaching out to us when needed, and we can help people find the resources that they need.
Yeah. Dr. May, of course, when we talk about doctors and screening, obviously in many cases they're going to come up against resistance from somebody who's a little bit suspicious of the questions they're being asked. And guys especially are going to be suspicious. It's just the way that they're built.
Well, I think, we are built to, like, that rugged independence kind of thing, particularly in rural America. You take care of yourself, it's weakness if you admit you feel depressed or you feel sad or you feel like crying. These things are the enemy of life, because when it comes to depression, your thoughts change. You start to get locked into this negative cycle. Maybe people will be better off without me. Maybe I'm just a waste of space. And men in particular, in our society at least, it's changing somewhat, but productivity, income producing, is highly tied to identity. It's highly tied to your meaning of life, right? Mm-hmm. If you don't have a strong faith, or you don't have a strong family, you don't have something else to support you, then your job, your income producing, and when something happens to that, it's like your very soul is challenged. And men have to understand that your worth, your value is not just tied to that. It's tied to a lot of other things. Depression causes you to think, if I'm not doing anything meaningful, I might as well not be here. And that's the risk. That's the population that I think is the greatest risk nationally, but particularly in Indiana County. And so we have to find a way. And I want to say, as Jonathan was saying, the screening at the primary care practice is a good thing. Most people who are struggling with depression, men or women, don't need to be in the hospital. What they need to do is be in counseling or receive medication for depression. Almost all the treatment's done in the outpatient setting. It's only if things get really, really bad, when you can't keep yourself safe, when your depression's immobilizing you, then short-term hospitalization sometimes is a place to start the treatment. But I think men are afraid, well, if I tell them I'm thinking of killing myself, they're going to lock me up. That's not what happens here. Mm-hmm. What happens here is you're assessed, you get the help you need, so that doesn't have to happen, or you don't end up dying by your own hand.
You and I talked about Senator Fetterman.
Yes.
And how his seeking treatment speaks to other guys.
Absolutely. I mean, whatever you think of John Fetterman, in my opinion, in my world, he's a hero because he came right out and talked about his depression and how serious and deep it was, and how he recognized he needed to get the extra help to get back in shape and get back on track. He will be okay because he listens to his brain. He understands when things aren't right and how to get the help that he needs, and he accepts it. And that, if I could package that, we would be in good shape.
Yeah, yeah. Jonathan, let's talk more about what you do and how you coordinate everything around the primary care physician and other professionals who can help people.
Okay. So in regard to just mental health, or?
Yeah.
All right. So whenever we do get referrals from physicians, we will call the patient and we will discuss what's going on. And I mean, we do refer out a lot. We work with a number of mental health physicians and facilities that are around here. So we work with Community Guidance Center, Family Behavioral Resources, Family Psychological, and Neuropsych, that's in the hospital. Mm-hmm. And I mean, even our department, we have a couple of LCSWs, licensed therapists, who are able to do therapy and help people with coping skills and work on the needs that people need to work on. And we also do brief interventions, which essentially is kind of like brief counseling, where we do work with those coping skills and those needs as well. We really have, I would say we have a pretty big hand in addressing the mental health on our side, because we are like on the front line, where we have to address these concerns. And there, like in Indiana County, there is a good number of people who do struggle with mental health. And if we weren't, honestly, if our health department wasn't here, I'm not sure where we would be. I think that we try to do our best to address these concerns.
Yeah. Ralph, when we were talking before as well in another visit, we discussed the fact that sometimes, when there is no structure in place for dealing with people that have mental health concerns, they get dumped in the emergency room.
Right.
And they literally get dropped off at the emergency room, somebody saying, you handle them, I can't anymore.
Well, I mean, the emergency room is a place where you can go when there's nowhere else to go. Absolutely. And there are psych liaisons there that will do the screening and treat it just like another condition, any medical condition or psychological condition. But we know that the emergency rooms everywhere are funnels. Every place is backed up because people wait until things are bad and they use the emergency room. So if you go into the emergency room and you're not really, really bad, you're probably going to have to wait because there's just so many people using that as a resource. So for us, the message is don't wait until it becomes as bad that you need to go in an emergency situation. You'll get the help, but it's better to anticipate things aren't okay here. I'm not feeling right. I'm having these thoughts that I might as well not be here anymore. I need to tell my doctor. I need to reach out. And I want to stress that in Indiana County, we have built a one-stop shop for crisis intervention. The number 877-333-2470. That's a local crisis number that is manned by a therapist 24 hours a day, 7 days a week, 365 days a year, that if you call at 2 in the morning because you can't sleep and you're having thoughts you want to hurt yourself, you'll have somebody to talk to immediately, and you don't even have to give your name. Yeah. You don't even have to do that. This resource is available to everyone at all times, and that's what we want to do. We want people, even if you're not sure or you're worried about your husband or your wife or your family member or your friend, call. I mean, we have put a lot of energy into making sure, and that number connects you not only with crisis intervention, but with other services you might need so that they link you. So it's really important to not think there's nowhere to turn. Yeah. Because there is where to turn. And if you need to go to the emergency room, go. But we would rather you recognize the symptoms early. It's like recognizing chest pain early. Don't wait until you're doubled over and keeled over and they have to call citizens to take you. Go to your doctor, get a cardiology referral and get assessed. Don't wait until it's that bad.
Yeah. We're out of time this morning. We could go on and on and on because it is such a deep subject, but we're going to have to stop the conversation now. The number again is
877-333-2470.
There you go.
24/7.
I don't want to give away a trust here, but early this morning I'm listening to the scanner, and there was somebody who was missing, who was known to be suffering from depression, and that triggered a whole bunch of people into action, and that's what we need.
We have a great response team here in Indiana County. I think people take it. You don't know you need it till you need it, right?
Exactly. Jonathan Hunt, good to meet you. Thanks for coming in.
Thank you so much.
Dr. Ralph May, we'll see you again as well. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160. 25 minutes after 9 o'clock, the CBS Sports Minute brought to you by S&T Bank.